Hello and welcome again to Biomedical Tech channel. It has been a long time without uploading any new videos, but we are here again with the new topics related to biomedical engineering and the medical field. So our today's topic will be the medical devices used in home care. This topic will be as a training course, okay? It will be more than one videos. We are going to talk about the medical devices used in home care and the classification of medical devices, what to do when you face a problem with a medical device as a nurse. So to whom this course will be? Actually, this course will be for the home care nurses and for the home care GPs and for biomedical engineers. So in fact, if you are not one of these three categories, you will find this video as a boring things for you. But if you are one of these three categories, I hope you will get some information that's very important for you, especially for the home care nurses. Okay, so let's start with this slide, the course content or the videos content. We are going to talk about the main differences between the home care patients and the hospital patients. We are going to talk also about the definition of medical devices. What is a medical device? What are the different kind of medical devices used in home care? Type of medical device used in home care, and what to do when you face a problem with a medical device as a nurse. Okay, and without calling the biomedical engineering teams or without calling the technical support, maybe you will find you will find the solution by yourself if you understand the working principle of the device or the medical device you use. And we will end this course or this video series. So first of all, let's understand what the main differences between the home care patient and the hospital patient. The home care patient receives medical or supportive care at home. So from the name home care patient, it's supposed to be at home with a long-term treatment, okay? And the hospital patient treated in a medical facility in the hospital, for example, the acute care, ICU, and general wards. So, generally speaking, the two types of these patients, one treated at home and one treated in the hospital. And in this table, we can see the differences. Okay, we will start with the first row for stable for home care patient. For stable, chronic, or recovering patient, focuses on maintenance, rehabilitation, or palliative care. And we have limited emergency support. On the other hand, for the hospital patients, it's for acute, severe, or life-threatening conditions. We need 24/7 access to doctors, specialists, specialties, emergency care, and something like this. We need advanced diagnostics. We need advanced medical devices. Maybe we need something very special. Maybe we need to take this patient in the hospital directly to the operating room. So we need a 24/7 access to everything in the hospital, to the newest medical devices, to the newest technologies. But for the home care patient, we don't need such a thing. For the home care patient, it's usually stable but needs assistance. Okay, the condition of the patient is stable. Okay, and it will be like this for long term. Okay, like for example, elderly and post-surgery rehabilitation. The patient, for example, who had a traffic accident before and need rehabilitation at home, maybe disabled patient. And we have, for example, chronic disease and illnesses in the patient, like diabetes. Maybe may require help with their daily activity, like bathing and medication. Okay, so those kind of patients, there's nothing mean from putting them in the hospital for a long term. So it's better for them and better for the hospital just to put them in home and put a nurse just came every day and just make the daily activity for that patient. The hospital patient, it's for critically ill, post-operative, or needing intensive monitoring. The patient with heart attack with severe infection. Okay. The main difference, which is the home care patient, is for long term, weeks to years. Okay, but the hospital patient is short term, days to weeks, unless chronic critical care is needed. Okay, so the main and the major difference: home care patient a stable condition long term, and the hospital patient short term, weeks to days to weeks, okay, and need access to the newest medical device, need access to the emergency facilities, and we can't wait because the situation may change, may need support at the meantime when it happens. So that's the main point between the home care and the hospital patients. For the second things I think we are going to talk about the definition of medical devices. Okay, actually, in generally speaking, a device is a thing. Okay, when you put an input to him, you will get an output. Okay, for example, your toaster, your vacuum machine at home, your blender. Okay, you will give him, for example, electricity or give him power, and you will get an output, which is the benefit you are looking for. So these devices used to help you with your daily activity. Okay, the medical device also the same thing, but here we are going to talk about the human being. We are going to talk about the medical things. So we need something really serious for those devices. A medical device is defined as an instrument, apparatus, machine, okay, or used for medical purposes. So it's a machine used for medical things. Okay, these devices are intended for diagnosis, prevention, monitoring, treatment, or alleviation of disease or medical conditions. So this is devices which is used in medical field. Okay, used for human body, used for the patients. So we need a very strict regulations around the medical devices because we need to ensure their safety and the quality in healthcare settings. So it's very important for the medical device to get under strict regulation to make sure that this device can give me the goal I need, okay, or the treatment I need, or the image I need as a, for example, diagnostic devices like ultrasound machine. So we need regulation. We need something really serious regarding these devices. Today we have more than 2 million different kinds of medical devices. This information according to the literature. We have in general we have about 2 million different kinds of medical devices. So we need regulations. We need laws, we need groups for them just to make our job easier. Okay, and those medical devices in the on the world market can be categorized in more than 7,000 different groups. So we have a 2 million device, we have more than 7,000 different generic groups for these devices. So the thing is very serious. The different kinds of medical devices. As we talked in the previous slide, so we have a huge amount of medical devices, huge groups. So we, as a home care patient, okay, what are the main groups for medical devices that will help me to understand the device and understand how can I deal with it? Okay. So we can classify them by the risk classification, by functionality, by duration of use, by level of invasiveness, and the material used. Okay, so we can classify them into this group also just to make our job easier. So by risk classification, we have low risk medical devices, we have moderate risk medical devices, we have high risk medical devices. Of course, high risk or low risk or moderate risk, it's according to the purpose of using this medical device. For example, the tongue depressor is not like the artificial joints. For example, also the surgical instrument for the bandages or for example the syringe, it's not like the defibrillators, it's not like the hemodialysis or hemofiltration machine. So because the aim of those devices is different. Okay, we have the moderate risk, for example the infusion pump, the diagnostic imaging devices like X-ray machine, and the surgical drapes. Okay, This device, for example, if we have in the diagnostic imaging device, if we have a problem in the device, in the device, it will not affect the patient's life, okay, at the moment, okay. It will affect the diagnostic images. But for the high-risk devices, we have the pacemaker. The pacemaker, we transplant it in the patient chest, and it's very important for the pacemaker just to make sure that everything is with the heart electricity is going well. We have implantable defibrillators. Also, we have also the artificial joints. So the second classification will be by functionality. Okay, we have diagnostic devices, we have therapeutic device, we have the surgical instrument. Diagnostic devices, we all know about these diagnostic devices. For example, ultrasound machine, X-rays, and blood glucose meters, stethoscopes, examples. Okay. We have therapeutic devices used for treating or alleviating symptoms. For example, ventilators, infusion pumps, and radiation therapy machine. So we use to make a treatment for a therapy. Okay, we have the surgical instruments like forceps. We have the surgical stainless steel material used in the surgical or in the operating room. Okay, we have monitoring device. Like blood pressure cuffs, like pulse oximeter. We have thermometer also. We have the vital sign monitor, as you can see in this picture. We have assistive device, help individuals perform tasks or compensate for a disability. For example, hearing aids, wheelchair, commode chair, and prosthetic limbs. We have the dental device. It's also as a category, okay, which means the dental units, the plating machine used in the dental clinic, and so on. This classification will be according to the duration of use. We have short-term devices, we have long-term devices. According to the literature, we have short-term devices like IV lines and dressings, include catheters, in one word, the disposable things. We have the long-term devices, okay, like artificial joints, like pacemaker, and implantable device, the hypnoid joint, for example, or the dental implant. Okay, the long-term device is supposed, for example, supposed to be, let's talk about the hip or knee joint. This device is supposed to help the patient at least 15 years. So it's a long-term device, and this device will be under very strict regulation. But for the short-term devices or the disposable one, it's often a few hours to days. Okay, for a short period. By level of invasiveness, we have what the meaning of invasiveness? Invasiveness, which means that interfere with the human body. Non-invasive devices, they don't penetrate the skin or enter the body. For example, the BP, thermometer, and the external diagnostic equipments. We are going to take or collect the data we need as an input for this device without penetrate the human body. We have also the minimally invasive devices. These devices may enter the body but don't do so during a big operation. Okay, we will enter the body through a small hole, or to make the invasiveness level as minimum as we can. Okay, example include the laparoscopic surgical instrument and endoscopies. You can see from the future, from this picture, sorry, we enter the body through this hole. Okay, and we have the cameras, and we have the forceps. We have everything related to do the treatment with the minimal invasiveness level. But on the other hand, we have the invasive devices. So we need to do a big surgery for the patient. We need to do cut for the patient's tissues, and to put the medical device. So in the invasive device, we have blood. These devices are intended or implanted into the body, often requiring a surgical procedure. So we have surgery at these devices. Classification. For example, we have the pacemaker, we have the artificial organs, we have the dental implant also. For example, you can see the dental implants. We need to put it in the jawbone. We needed to put it, for example, for this pacemaker, we needed to put it in the patient chest and connect it to the heart. For the knee joint, artificial joint, we need to do the surgery and put it instead of the patient's natural joint. By materials used, we have metal-based devices like the implant. For example, we have here the hip implant, we have the femoral stem, we have the femoral head, and we have also here the plastic, which is under the second classification, which is plastic-based devices like syringe made from medical grade plastics or polymers, okay, such as syringes, tubing, and an implant. And by this video we end the part 1 of our course. On the second videos or the next videos, we are going to talk about the other topics, how to deal with the medical devices, the kind of medical devices used in the home care. As a nurse in a home care, I have a medical device and I have a patient. How can I make the way of work as fast as possible without any complications? So I hope you enjoyed our first part. I hope that I gave you the information you need, and also I ask you just to subscribe to our channel, just to put like, and I need to hear your opinions in the comments. Thank you very much, and we will see you in the next video.